Hello everybody and welcome back to the MedBros channel. In today's video, we're going to be doing something really interesting. This is a show that I've been putting off for a very long time. And now that I am a resident, we are going to be watching The Resident. So this is a real resident reacts to the show The Resident. Now, I'm not a big fan of medical dramas in general. I know we watch some interesting ones here on this channel, especially the Indian medical drama Sanjeevani. Make sure you guys check that out. Me and Puneet will be reacting to another Indian drama coming up. So if you guys enjoy these kind of videos, be sure to subscribe, hit the like button below, and leave a comment down below. But without further ado, let's get right into The Resident episode 1. Okay, classic OR scene. Usually there's always an OR scene that we start with.
Bill, yank that sucker so we can get out of here.
No, the appendix hasn't burst. That's good news. Slippery little fellow. It is totally inappropriate. Go back to your stations.
Oh, we're just having fun. He's out cold. He'll never know.
Wait, I'm gonna take a quick selfie.
Okay, this is already very questionable.
I wish we could do one without the mask.
Oh, something's happening here. Yeah, this is a lot of clowning around. Jesus.
I think we got it. I'm going to send this to my mother.
You'll get us on fire. Cameras aren't allowed in the OR. He's waking up. I need to up the SIBO.
What is happening?
Artery?
Okay, an artery is not gonna.
You're losing blood fast.
So first of all, this is already very triggering for a lot of medical providers, I'm sure, out there. Nurses, scrub techs, whoever is out here is probably just cringing at the sight of this. You know, I'm not going to lie and tell you that I haven't seen very similar scenarios like this going through my medical training, 3rd and 4th year medical school. I've heard of crazy, crazy stories happening in the OR. But, you know, this is definitely inappropriate behavior, having your camera out, taking selfies, especially the anesthesiologist who should be looking at the vitals at all times. You know, situations like this can happen if you don't keep an eye on what the patient's vitals are doing. Are they heart rate speeding up? Does they need another push of medications that are keeping them under? This is something that the anesthesiologist has to be looking at all times. So leaving your station and having that happen, definitely inappropriate. Let's see how they handle this situation. I think we're off to a very rough start.
I need 2 liters of normal saline wide open. Call for 4 units of blood and 2 FFP.
I wonder who is the resident here.
Backing suction.
You have to clamp something. You've
She's
lost
right
at
about
least
that.
2
You have to
liters
stop the
already.
bleeding immediately.
We just lost a pulse PA rest.
Pressure, Cheryl. I'm starting compressions.
Okay, those are really terrible compressions. He doesn't really have his body over the patient.
CPR is
That angle looks a little better.
back into his body.
Someone should be getting epinephrine. Someone should be calling code blue.
It's no use.
This feels like very dreamlike. I feel like someone's going to wake up. Like, is this really real? It's got that kind of like dreamy, hazy vibes to it. I feel like one of these doctors is going to wake up. He is so dead. Jeez.
Time of death, 12:03.
Is this really how we're opening the show? I'm guessing he's not the resident. He's probably the attending. So it seems like there's a very standard procedure, removing the appendix, and unfortunately, even on these standard procedures, things do go wrong and you die, but this is kind of a horrific kind of freak accident here, apparently.
Well, I think we can all agree it was the misdosed SIBO that led to this unfortunate situation.
You're kidding, right?
The patient woke up. His arm hit my hand.
You left the blade in the field. You nicked the artery.
Well, you never should have okayed him for surgery in the first place. His INR was abnormal.
The upper range of normal. That's never gonna
You know,
fly.
I'm flashing back to the time when you tore through that old woman's oropharynx on a routine intubation. Did that fly? I covered for you. Not this time. I'm chief of surgery, and he's at the end of a 30-hour shift. What did you see?
We're all on the same team here, right?
So this is, I don't know how often, I do wonder how often situations like this does happen. I'm sure it does happen throughout this country. Things go wrong during the operating room, and doctors cover for each other. Doctors have definitely covered for each other, just like in any other field that you would get. This is kind of very blatant red flag situation here, though. I have seen mistakes being made, and every time a blatant mistake has been made in front of me, that the attendings I've worked with, they do own up to their mistakes and don't try to put it under the rug like this. If you leaving a blade out on the field where you're operating and somehow the patient wakes, like that was so many things gone wrong all at once in the 5 seconds time frame. So I don't know. This is a very unfortunate situation and an unfortunate way to handle it.
Maybe he had a heart attack.
Maybe he had a heart attack. What does that even mean? What is that statement?
Yes, there's some family history of heart disease.
Yes. His left main clogged. Sudden cardiac event.
Tried CPR. He was unresponsive. That
Well,
works.
you can't just say his left main artery, which is one of the main arteries that supply your heart, just clogged. You need evidence of that. Damn! Okay, this show is starting off to a very precarious start. Hey. I'm guessing this is our resident, probably a protagonist here. I don't know if that was going to be his attending later on, but let's see.
That's handicap, pal. Yeah, whatever.
Interesting soundtrack for someone rolling up in a bike, but all right. Hey, hey, CEO. Okay. Okay, I'm guessing this is our ballsy resident coming in here. Who's this? Oh, this is so classic anatomy, Mr. Hotshot Medical.
No, stay. It's early.
I don't want to be late on my first day.
Who is this? I thought the other guy was going to be the main resident. I wonder who this guy is. Oh, and it's an Indian guy. Let's go, dude. Okay. Harvard, Pravesh. All right, dude. There's Dr. Bell. Very Norman Osborn vibes to that guy, huh? Are we going to be following another surgical resident?
Excuse me, Dr. Bell. I just wanted to say that I really admire you, and you're the reason why I chose this residency.
Well, you made the right decision. Good luck to you.
God, Pravesh, man, you're gonna be that guy. You're gonna show up right there to Mr. Dr. Bell.
By the Pope.
Oh my
My
God.
supervising resident just texted me.
Who's that that texted him?
You know where I can find Dr. Conrad Hawkins?
Namaste.
This guy's got a medical tattoo.
Take off
Oh
that
my
tie, you're not
God.
What are you into? White,
Oh
black,
my God.
men?
Pause, bro. What the hell? If this is my senior resident right there and then, I don't give a crap about I'm an intern and this is my senior. So I'm guessing this is the intern and he's meeting a senior resident. If this is my senior resident, oh my God, I would hate this guy right off the bat. Are you kidding me? Oh my goodness, dude. Telling me to take off my tie. I would never take off my tie. Pravesh, I swear, did he take his tie off? I missed that. Pravesh, you better not have taken your tie off, boy.
I don't understand what you did.
I don't understand. Were you affirmative action at Harvard?
What? What does that have to do with anything? And affirmative action, Pravesh definitely ain't getting in off affirmative action, buddy. I'll tell you that much.
I read your file, bro. Yale, then Harvard. Let's go. 19 first authors. Step 1 score, 267. I got 280, by the way. Top of your class, followed all the rules, and you think...
Now, here's the thing, right? Unfortunately, these people actually do exist. I have come into contact with residents, especially when I was on the interview trail. I still remember this one resident very vividly. That they try to be cool and try to come off as this, like, new age, new vibe. Like, I'm the cool guy, man. I'm the cool resident. and it just comes off so horribly. Like they're cussing a storm up. They're acting like they're different. They're acting like they're doing something cool. They're the people that are going to end up being those really annoying attendings you hate. Like you're just here. This Indian guy here, Dr. Pravesh, is just here to do a job. Okay, he doesn't care about you, Mr. Hotshot, running around thinking like you're the crap. This guy just wants to come here, wants to help his patients, he wants to be a doctor, he wants to go home, he wants to have a life. Then you run into fellows like this that are just so damn annoying. Like this is triggering already. Let's keep going. I have a feeling it's gonna get worse.
Put you at an advantage. It doesn't. It just means you have more to unlearn than the guys who weren't paying attention.
Over easy, no cheese, no mayo, breakfast sandwich.
Good man. Second year. I broke him. Now he's a doctor. You're not. You got your little white coat, though. Your stethoscope, your pen light. You're all ready to play doctor, right? No. It's not like that. We're not laughing together. Everything you thought you knew about medicine is wrong. All the rules you followed will break. I have only one rule, covers everything. I'm never wrong. You do whatever the hell I tell you, no questions asked.
Do you want me
Let's
to
go,
speak?
Pravesh.
That's a question. No. Don't do that. Don't do that. Eyes on me. My last resident had an attitude too, and you know where he is now? He's teaching 8th grade biology. I cut him. Do you know what that means? It means I can end your
Let's go,
career.
Pravesh. Don't take shit from this guy.
That.
This guy
Remove you
can't do
from this
shit.
Residency at any time for any reason, and if I do that, no other residency will take you.
Let's go, Pravesh.
All you'll have left from that fancy Harvard medical school degree is a mountain of debt. Let's meet your first patient.
Just for all you intern medical students, anybody watching this show, your senior resident ain't gonna do shit. He ain't gonna cut you. He ain't gonna be able to do anything to you unless he has egregious information that you screwed something up major. He ain't gonna do shit. Don't ever be scared of your senior resident who's just a baby just like you are. Like, are you kidding me, dude? This guy is so triggering, dude. Pravesh better step up, man. Pravesh, you better step up to the plate. I don't know if I'm gonna watch any future episodes depending on how this does. We can watch future ones, but whew.
This time.
Tell me about the new admission.
Alopecia, discoid rash, rising urea
Lupus.
nitrogen.
Yeah.
Lupus.
Okay, Mr. Hotshot. Okay, now we'll add on salt. Add a salt onto the list of things the senior resident is responsible for. Again, just to let everybody know, for complete transparency, this activity does occur in the hospital, although if you are caught, you will lose your job. As we've had previous residents that I've heard of lose their job for using the resident workrooms for activity that's not supposed to be done in resident workrooms.
Nick. Feed cultures from both arms. Urine, she'll need a head CT.
Okay.
Don't worry. We'll get this under control.
This is, oh my God, is this really gonna happen?
You're in good hands. Guess where he went to medical school? I think he went to Harvard Medical School. Was it Harvard Medical School? I'm pretty sure it was Harvard Medical School. Lily.
That is so freaking annoying, man. Like, this stuff does happen. I've definitely seen, not a senior resident behave in this way, but this is like giving me vibes of attending physician that I've definitely had in the past, where they're these pieces of crap, really, once you step away. But once a patient comes, oh yeah, we're buddies, yeah, you make you the butt of the joke, and you're super cool with the patient, and then he's super cool with the patient. Like, my God, this is very triggering. This is very triggering. This is the kind of senior resident / attending you do not want to strive to be. This guy is so annoying. And I'm suspecting, I would be shocked if, unlike, some of these other medical shows where these tough and rough guys are like the main character that everyone loves, like House, this guy, I would be shocked. Like, you guys tell me in the comments, is this somebody that people like? Like, is this a character that he likes? Like, I'm totally a Pravesh fan right now. This guy is so triggering.
How'd you get that cheeseburger, Chad?
This is so true. I don't know how patients do this. Sometimes I'll walk in and the dude's having he's a heart failure patient, liver cirrhotic patient, supposed to be on very low sodium diet. And I walk in and they're having a Big Mac, large fries. And I'm like, what? How did you get the Postmates? I Postmates it up here. I was like, what? Like, what the hell? Or some other times you'll have family members like sneak in stuff like in their jackets and stuff. Like, my God, it's so frustrating.
Took all my money and put it on
Okay, drug overdose patient on.
These are Osler's nodes.
Now that I will give credit where credit is due. If a resident ever picked up Osler nodes and then had a drug history, now you're concerned about bacteria in the body due to the drug injections that she's doing, which is possibly traveled to her heart, causing endocarditis. And that can cause kind of embolus from your heart to different parts of your body, and then can also cause things like Osler nodes and other things like these raw thighs and things like that. So the fact that a resident could pick that up that quick and put together drug history, you possibly have endocarditis, this guy's good. This guy's good in terms of his medicine for sure. They're making him out to be a pretty good resident doctor.
Caused by bacteria swarming in your blood and moving throughout your body. Classic for endocarditis, an infection of the heart valve. Happens to drug users all the time. If you walk out of here without any antibiotics, this will kill you.
They know how to be doctors.
Chloe, baby!
Get a crash
Code
cart.
blue.
Come on,
That
baby.
was
I'm not getting a
insane.
pulse.
Code blue and ED Alpha.
Get out of here. Start compressions. You're running the code.
I've never run a code.
Do you want an amp bicarb?
He's in charge.
Page anesthesia.
Oh my God. Okay, I understand. You're trying to teach, man. It's the intern's first day. Now, granted, you probably should know the basics of running a code. Does the patient have a pulse? If the patient is pulseless, if they're pulsed, that's going to kind of take you down different algorithms. Immediately start compressions if you do not feel a pulse. If you do feel a pulse, then you have time to think about what's going on. But if they don't have a pulse, that should be the first thing you assess, and then
What
do
is the first
compressions. So
question
let's see
you
what
ask
happens
in
here.
Rhythm. What's rhythm?
Well, before rhythm, you need to know the pulse.
PEA.
So pulseless electrical activity is PEA. That means they do not have a pulse. You need to start compressions and then get that epinephrine over here immediately. And then you continue the cycles. Compression, epinephrine every 2 minutes. So let's see what happens.
Should we shock?
No, we can't. A rhythm's not shockable. Get me one of Epi. Make those compressions
There you go.
harder and faster.
There you go,
Prepare to
baby.
innovate.
There you go. Secure the airway. Very good. Started bagging her, continuing compressions.
It's been 24 minutes. It's time
It's
to call
been
the code.
24 minutes.
This is my code. You gave me this code. She's 21 years old. Harder, man. You need to feel the ribs crack.
Yeah, those are terrible compressions, by the way.
That's enough.
No. Move.
There you go. Let's go, Pravesh. Get in there, boy.
I'm not giving up.
Let's go. 24 minutes, though,
said that's
realistically, I would probably call it at this point. Let's see what Pravesh has got. Let's go. Let's go, baby. Let's go, Pravesh.
We got a pulse.
You saved her life.
Let's go, big boy.
Her end tidal CO2 is less than 15 for the entire code.
That doesn't necessarily mean that...
Yes, it does. She's been without oxygen to her brain for 26 minutes. Congratulations, you got her heart beating again, but she's brain dead.
That's exactly why I said earlier why I would call the code. I'm telling you, man. Oscorp vibes. Is this guy gonna fly in with a Green Goblin suit in the rest of this, and maybe Pravesh ends up being the Indian Spider-Man? I have no idea, but that's the vibes I get from this show so far.
As you can see,
Hey, look at this guy.
petition
This is Oscorp
an
right now.
amazing piece of medical technology.
Dates on how the surgeries went one by one. Are the families all assembled?
Dr. Okafor, you have to talk to them each individually. There are rules about this.
I get it. Lewis is doing fine. He's in recovery. Raj is in the ICU. It's touch and go. Prescott's dead.
No way, dude. I have to. If you ever had a doctor walk in on the patient's family and just say the patient's dead, you should not be doing that job. You shouldn't be doing that. Like, there needs to be, like, you can have some arrangement set up so that someone else is doing the job of going to talk to patients, because that's just terrible. That's one of the worst things I've seen in this show yet. That was just like, what the hell?
The surgery is first thing tomorrow morning. There isn't enough time to bring you up to speed. I have to draw a line here. This can't happen. It's too risky for you and for the patient.
Oh, then I'm afraid you'll be heading back to Abusha. And as you know, immigration to the States has become quite difficult. We're shutting our doors. Given the political unrest and the quality of healthcare available in Nigeria, you might want to reconsider. If I help you, you'll get your visa. If I don't,
This show is wild. Like, listen, medicine has shady things going on, but it is not this crazy corrupt. You don't, as far as the programs I've been at, maybe I'm under the rug, but like this is some crazy stuff. Like, don't get me wrong, I've seen shady stuff going on. I've seen, things go wrong and people cover each other up and things like that. Okay, we've seen that. That happens in every single field, but like look at this shit. Like, are you kidding me? This is taken to the extreme of corruption. Like, this Dr. Bell fellow is insane. That other senior resident, while his medicine is insane, that is a crazy personality. He's a little more realistic than this Dr. Bell guy. This Dr. Bell guy is just wild, dude. This guy's running rampant. Oh, damn, unresponsive. She might be heading toward a code, but you call it rapid response right now.
Can we please get rapid response now?
Oh, there he is.
Get a CBC,
Let's go,
CMP,
Pravesh.
LFTs, lactate.
Yup,
Is the
labs,
IV wide open?
everything.
Stomach's
Okay.
fluctuating, but it's not good.
We're 3 liters in already. It's sepsis.
Want me to give Nor-Ep peripherally?
No, get a central line.
No.
There
You've
you
never
go.
done one. We wait for Conrad.
We can't. She'll die.
Prepare the iodine
Okay,
drops.
our Pravesh,
Put the
damn it,
Nor-Ep
getting
fast on the
ballsy,
table. Get
man.
farm here now. I want 12 leads on her.
How
at
do you
all
even know
times.
how to
Call
do
for
a
an
central
ultrasound as
line?
backup.
So due to COVID, my program was not really able to do these kind of hands-on procedural things. So I've been learning how to do them as I go. I usually have a fellow kind of teaching me through it. I did a few central lines in ICU and arterial lines and things like that. But to walk in on your first day, I mean, this is still his first day to do a central line. So off the bat, that's when you take a line and you put it in one of your central veins. So the medications and fluids and things like that can be directly given into your system rather than peripherally, where they go through like an outside peripheral vein and then they go into your system. This is directly into your central system, like into your superior vena cava and kind of your bigger veins that'll kind of directly take the medications, get working really fast. So that is much more preferred for medications like norepinephrine, where you don't want to do it peripherally. It can cause a vasoconstriction of the outer vessels and of that nature. So he's ballsy for trying this. Let's see what you got, Pravesh. That is, I would not be able to do that. I would call a fellow for sure.
Scalpel.
Scalpel.
Is she a senior? Like, I don't understand. Who
Have
is she?
respiratory on page, please. Oh, good. Her pressure's crashing. We need a central line now.
I can see that. Go on. Do it.
Conrad, seriously.
You heard me.
She's right. You should do it, not me.
Then why are you here? Pre-med, med school, MCATs, was that just for fun?
Come on, be a doctor, or go be something else.
I mean, you're about to do it, Pravesh. He's right there.
Stats are
Just
slow.
go ahead and do
Pressure
it.
70/38 and dropping
If you,
fast.
I mean, if you know the steps and he's there watching you, I mean, you can go ahead and try to do it. There you go. You got it. It's really not that insane of a procedure to do, but I mean, there are certainly complications. You can cause pneumothorax. You can cause, you can miss and hit an artery and cause bleeding, especially with our blood pressure dropping. So, oh God, I remember all this stuff.
Okay.
I'm not the biggest fan of these kind of
going.
procedures,
So far, you haven't killed her.
especially because a lot of the times it is time sensitive, like
Start at
starting the
5
arterial line or
micrograms.
even the
Titrate
central
up
line
as
here where we
needed.
need the medications quick.
Don't look at him. I'm right and you know it.
What next?
When her pressure level's out, wean her off the Norepi and then drown her in fluids.
Congratulations, we just busted your cherry.
One way to say it, Jesus Christ. I would say Pravesh is very impressive for his first day. Very impressive for his first day. Got a central line in, ran a code, ran a rapid. Like, really, really impressive first day, man. Me as a senior, I mean, going into my senior year now, I'm not even that confident really doing all that stuff. I've done each of those scenarios now. Ran a code, ran a rapid, ran a, put in a central line, but always under supervision, always under a lot more care than a senior resident that just says, do it, bro. Why are you here? That was an intense first episode. That's a lot going on. Honestly, that show's pretty good. I'm not gonna lie, I'm pleasantly surprised at episode 1 of The Resident. I can't believe I have not watched it for so long, but now that I am a resident, there's actually a lot of shockingly relatable stuff. I completely understand some of the stuff Pravesh is going through. I understand the perspective from the senior a lot of the times. Never really gonna understand what's going on with that attending, who is absolutely wild. But if you guys want me to watch more, make sure you like this video, comment down below. I have to say I'm more intrigued about this show than I originally thought I was going to be. But anyway, guys, that was interesting. I had a great time watching. I hope you guys did too, and we'll see you guys in the next one.